So coming back to the same topic, breaking the bad news. So be very careful. It has to be handled on its own merits as well. So immediate breaking the news is sometimes necessary to declare the death immediately. So this has its good and bad as well. But the pros is that the violence can be reduced. Okay, because if you delay around breaking the news, that could lead to the family telling that there is some foul play around it, and that could lead to any violence or abuse. Okay, so be immediate, be empathetic when you're breaking the news. Be empathetic because a grief wave is hitting the family. Be empathetic and show them sympathy of their loss. After cover up, it does not mean that you're manipulating anything. Cover up here does not mean manipulation. Okay, for example, if you keep the patient alive on artificial means and you pretend that the patient is alive. Okay, so these kind of cover ups are called manipulations. You have to avoid that. That should not be done. And even if it is a common, like for example, even if the patient is on ventilator and the patient passes away, not necessary that you have to immediately remove the ventilator. Okay, you can break the news slowly after in telling the patient family that what happened. Even when the patient is still on ventilator but passed away, they can come and see the patient on ventilator, and then you can slowly remove the devices. So that is the after cover up. Okay. Then we have the through the staffs, when some terrible accident is taking place, like sudden death is taking place uh, during the OT, during the operation or during post-op, when you know that the doctors are agitated, doctors are trying to save the patient. At that time itself, when you have a doubt that you cannot save the patient, you can send your staff to go and inform the family to be prepared for a bad news. Okay, you can do that as well. But in some case, the patient party may insist that they want to talk to the patient, they do not want to talk to the staff. So at that point of time, you can go, making sure that all the efforts of resuscitation has been exhausted and you still cannot save the patient. Then you can go out and inform the same, you can verify the same thing with the family. Okay, so you can send the bad news through your staffs as well. When you are busy resuscitating the patient, you are trying to use all the methods possible to bring back the patient to life. When you are doing that, at the same time, you can inform the family through your staff that something unexpected has taken place. Even if you're not breaking the bad news, you can give them a heads up that, okay, please be ready. Something unexpected has taken place. Okay. So that could reduce the chances, because the family may see that you are trying your best to save the patient. So that could still dilute the situation as well. And when you are explaining the unexpected death to the family, make sure you are doing it in presence of your colleagues. That could be used as a witness also. If at all the family members go for filing a case against you, okay, your colleagues could be called up as witnesses as well. So make sure you have witnesses in form of your staffs, like nurses or your colleagues, your seniors. Okay, make sure they are present when you are breaking the bad news with ethics and protocols. Next, coming to the medical legal aspects of sudden death. So, all the sudden deaths are treated as accidental death, and only a very high degree of negligence, if it is proved in the court. Okay, only then it is considered as a negligent or a rash act, and the doctor can be tried in court. Otherwise, it is treated as an accidental death where the doctor is not sued or the doctor is not arrested. So all the sudden unexpected death are treated as a cognizable and bailable offense. You can't keep the doctor behind the bars or in the prison just because of sudden unexpected death. On request of the doctor, the custody of the human remains of the patient can be taken for postmortem by the police if the police is involved. and whoever is the investigating officer for your case, which the family member may have filed, whoever is the investigating officer, you have to take all the copies. They may demand you that they require all the copies of the case file, documents, operation records, post-op records, etc. You have to, you can ask them for some time to make the Xerox copies of it, and then you can hand over them the Xerox copies. Now, in case of patients who are brought dead, okay, so this situation is usually mainly faced by pediatricians, general practitioners, or general hospitals. In the OPD situations also, these situations can arise. Okay, so the question here is death certificate, the cause of death should be informed the police. Okay, what records should be kept? These kind of questions are the administrative questions that will arise in such a situation when the patients are brought dead. Okay, so make sure that you always attend the patient cases, the brought dead cases. You do not tell your staffs, nurses, or physiotherapists to go and attend the case. Okay, you yourself has to be present. You yourself has to attend all the brought dead cases, and immediately you have to prepare the OPD case paper, the date, timing. Okay, at exact what time did the patient arrive. Okay, and the name of the people who accompanied the dead body, okay, who brought the patient, what is the relation with the deceased, okay, and at least two identification mark on them, the people who brought them, okay, not the patient, but the people who brought them, to identification marks of the bystanders, their signatures, name, and make sure you have two witnesses also, preferably the bystanders and the relatives of the deceased as a witnesses, so that uh, uh, you if something goes wrong, you can call up the witnesses in the court. Don't use your staff as a witness. It should be someone who is not working for the hospital, should be the witness of a brought dead case. Okay. Write down the history which is given by the relatives by verbatim, like what orally they have said, what verbally they have said. That history has to be noted down in the OPD case paper, and at least two identification mark on the dead body to identify the dead body has to be noted down. And after all this, at least after 5 minutes of examination, and use ECG machine also, according if possible, check all the signs and symptoms of death and then declare the death. If you are suspicious of something, you smell a rat, you are suspicious of something, you can hand over the case to the medical legal team. You can call the police as well. And death certificate, in which case you can issue the death certificate when you know the case. Okay, you know that this patient was being treated under you, some home-based treatment, OPD-based treatment is being given to this patient under your guidance. In such case, you can give the death certificate. Next, coming to settlement of bills. This is again a very difficult situation to tackle, and you require more of a managerial and manipulative skills here to tackle such situation. So first and foremost thing that you can do here is you if you can, forego the bills. Okay, let go the bills and forget it for once and all. If possible, to protect yourself financially, what you can do is take an advance check of whatever is the solicited payment details, or whatever could be the cost that could have added up. Make sure you have took the advance check for that. Okay, so that would safeguard you as well. And if possible, try to discount the bill, reduce the bill as much as you can, based on the capability of the patient, based on their family situation, financial situation. How much ever you can, try to reduce the bill. Use mediators. Okay, these mediators could be acquaintances or the patient party. Okay, apart from the close relatives, but whoever is a mediator, that is an acquaintance to the patient party. Okay, you can use mediator as well to communicate. And if at all you want to take this legally, you can file a civil suit for recovery of bills, but it is a long waiting period. Okay, it is a very costly matter, and you have to wait for a very long period to get justice. Okay. And if you know that this patient or this patient party has a history of non-payment, okay, they are known for, they're well known for not paying the bills. If you know that, you can refuse to see the case in the future or treat the case in the future. So that's all about difficult situation in practice.